clients often ask us how to monitor client compliance in their practice. So we developed this easy-to-use compliance audit worksheet to do that. And when you open the file, it opens to the instructions. It's a pretty intuitive worksheet, but we do provide you some instructions so that you can get a sense for how to use the program. And I do recommend reading the instructions rather than just starting out. They're brief, so it's pretty easy to use the program. So there are tabs across the bottom of the file, as you can see, and the instruction file, or the instruction tab, is what the program will open to. Then if you click on the next tab that says Compliance Details, this is where you enter your information. And this is just a quick way to identify what your current compliance rates are in different areas of healthcare, and allows you the opportunity to set some client compliance rates, and then the program will calculate for you how much your revenue would change if you hit your target compliance rates. So on the worksheet, you can compile this information by doctor, by individual doctor, or overall for the practice. And for today, I'm going to assume overall for the practice. So on line 4, you would enter your practice name, and I'm just going to create a practice name for discussion today. So we're going to use Pebble Creek Animal Hospital. So we just enter the hospital name. Oops, if I could spell correctly. And then in each of these areas, we've got 6 areas of healthcare built into the program. And then we've also got the opportunity for each practice to select their own areas that they want to monitor. So the healthcare components that we've built into the program, the first is fecal exams. So basically what you do is go to your veterinary practice management software and do a database search to identify the number of active patients that you have. And my definition of active means that you have seen that patient at least once in the past 12 months. So on the first line, the number of active patients, you would enter your number of patients. And I'm going to assume that Pebble Creek has 5,000 active patients. The next line, we set our target compliance rate, our desired compliance rate for fecal exams. So what % of your patients do you believe need to have a fecal exam? Pebble Creek set their target at 90%, recognizing that there were going to be some patients that didn't necessarily, for one reason or another, need a fecal exam. So if they hit their target compliance rate of 90%, that means that they would do 4,500 fecal exams for the year. Then go to your practice management software, your veterinary software, and print the report that shows the number of fecal exams that you actually did. There's a report that shows the number of occurrences. And for Pebble Creek, that was 3,500. They actually did 3,500 fecal exams. So you can see the program has now calculated their actual compliance percentage. So it's 70%. Their target is 90, they're at 70. So if they would increase, if they would hit their target compliance of 90%, then they could potentially or would do 1,000 more fecal exams. For Pebble Creek, they charge $25 for their fecal exams. So if they hit their target compliance of 90%, do the 1,000 extra fecal exams, they would generate an additional $25,000 in revenue. So this is a great little worksheet to identify not only how are we doing from a patient care standpoint, but also financially what would be the impact, the financial impact in our practice if we hit our target compliance rates. So good for the patient, good for the client relationship, and good for the bottom line. Heartworm tests, Pebble Creek has 3,500 active canine patients, and their target compliance for heartworm tests is 95%. That means that they should have generated about 3,300 or completed 3,300 canine heartworm tests. When they reviewed their veterinary software, they found that they actually had done 2,500 heartworm tests. So their true compliance rate is 71%. Through their compliance initiatives, if they're able to hit their target of 95%, they charge $35 for their heartworm tests. They would generate an additional almost $29,000 of revenue. So you can see real quickly how easy it is to identify, one, what is our actual compliance, two, how could we improve our bottom line if we hit our target compliance, and three, it's a great way to open up discussion internally to work together to improve your compliance rates and get everybody on the same page. Feline leukemia, FIV, heartworm tests, they have 2,500 active feline patients. They set a target compliance rate because of lifestyle. Not all of their feline patients need that particular test, so they set a target compliance rate of 60% for this particular test. That means that they would have done 1,500 of these tests if they hit their compliance. They actually did 1,000. So their true compliance rate is 40%. If they hit their target, they would do an additional 500 tests. They charge $50 for this test, so their increase in revenue would be $25,000. And I won't go through the rest of the areas. The other areas that we have targeted in our program, senior screening panel, but the principle is the same. You really identify how many senior patients are 6 years of age or older, and what is our target compliance rate for those seniors to have a screening panel. How many did we actually do? What do we charge for that item? And what is our actual compliance rate, and then how much could we increase our revenue? Pre-anesthetic blood work, here you'd have to identify the number of surgical cases on average that you do each year, and what is your target compliance rate. Do you require pre-anesthetic blood work on all of your surgical cases? Is it an option for some of them? So what is your target compliance rate? And then again, from your veterinary software, identify how many you actually did, what you normally charge for that, and then the program will calculate what your increase in revenue would be. For dental, is a little more, a few more lines to fill in, because we want to evaluate compliance based on age of the patient. So your number of patients that are 3 to 6 years of age, your target compliance rate for that age group, that age demographic, might be different than the target for the age demographic of greater than 6 years of age. So we've got a few extra lines that you have to fill in. But again, all of this information you should be able to get out of your practice management software. So set your compliance rates, evaluate or find out how many you actually did, what's your average routine dentistry procedure go out the door for. That's what the fee that you want to enter here. And it's an estimate, because I realize that different dental procedures cost a different amount depending on the complexity of the procedure. But here we're just trying to get a sense for how much your revenue could grow if you everybody was getting all of your patients were getting the dental procedures that they need. The program has the ability for you to choose at least 3 other areas of healthcare that you want to monitor compliance for. So you get to choose, and you can type in, let's say that you want to monitor rabies vaccines. So you would type in rabies vaccine as your next area that you want to monitor. And again, enter your number of active patients, your target compliance rate, find out how many you actually did, and what you normally charge for that to calculate your increase in revenue. Then if you click on the last tab in the file, you see this wonderful summary that the program has automatically calculated for you once you've entered in all of your target compliance and your actual numbers completed. The program will do the math for you to show you bottom line, if you hit your target compliance rates in all of these areas, here's how much your revenue could grow. So it's a wonderful way to identify the untapped potential in your practice. And there's huge untapped potential in many, many practices. So I think this is a tool that every practice could use on a regular basis.